individually different, and it can also be culturally different. So as an educator, you're working with both individual and cultural differences, as well as developmental differences, right? Because as we grow and change over time, what makes sense to us is different. You know, there can be more magical thinking at some part of development, more linear thinking at other parts of development, more rule-based thinking, so on and so forth. So you're always kind of having to connect with the thinker, with the learner. Yes, ma'am.
Another question. In the beginning, you were talking about how memories serve us by protecting us and guiding us. So I know in the last 20 years or 10 years, everyone's talking about let's be in the moment. You know, pay attention, be present. And what I've found, and I've always been curious about this, is what bringing me here today. So we're in the moment. I'm sitting here. I want to be with her, but actually, I look in her eyes, and she reminds me of the brown eyes are like somebody else's eyes. And how, with memories, can we be here now? It seems like I'm constantly flashing back familiarities, a certain smell of her shirt. Is that how it's supposed to be, or can you actually be in the moment without memories? Or it just seems like memories do not serve being present.
Well, that's not really that. I would argue with that point. Memories probably do serve you with being present, because you can be both present in this moment now and still have all of your social learning history to inform you of that. So you may remember that the person sitting next to you has eyes like your best friend from the 3rd grade, and that would help you remember what color her eyes are.
But now I'm thinking, okay, but then I want to meet this person, but now I'm thinking about something that happened 10 years ago, so I'm aware of both things at the same time, so in that way, I guess you're present.
So the idea behind being present is learning how to refocus yourself to this moment. So understanding that we have several complex cognitive processing happening in the brain at the same time, but being able to choose where to focus. There's an interesting class actually at South Miami Hospital called Mindfulness-Based Stress Reduction that will teach you how to do that. You can call the Collaborative Medicine Department for more information.
Do you have a copy of your presentation?
I emailed it to someone here, to Amy. Yes.
We can send it out to everybody as long as you left us your email address.
Yes.
We'll send it out if you're comfortable with that.
That's fine. Yes.
Yes. I'd like to ask you something. You mentioned about the mother, she has more responsibility for the baby, what have you, and then when the father, instead of parenting, they go and help.
Mm-hmm.
And I want to ask you, for example, when a female, when we carry the baby, the brain, right, you have this oxytocin, this hormone, is that hormone?
Yes,
That's
oxytocin.
hormone, so I don't know.
That,
I just
well,
try to learn.
right.
And that will ensure the survival of that baby, and it's like sort of like that bonding with can the father
Can the dad get some oxytocin?
yes.
Um,
No, it's funny because I feel I have a grandson, and even though I didn't birth him, I feel almost like that same, that love and that bonding and that, it's almost like falling in love.
You-
It's a grandson.
right. So you feel the same kind of bond that you do as a parent.
Create that, because I see my son-in-law is a wonderful, he's not helping, he's parenting and so on my nephews. These younger generations, I see that a lot of them are really trying. And could it be sometimes that mothers, because of that, get just overprotective and don't know how to do it better, or of course if you're breastfeeding,
You know, I'm not exactly sure what the oxytocin research is. That's just not my area of expertise. So whether or not men can take it, I don't really know. But I'm thinking that a big part of learning how to parent or be engaged with a child is about practice and about receiving the little intermittent pieces of positive reinforcement from the child as you are spending time with the child. That helps you, engage, feel the love, the whole thing, because you're intermittently being positively reinforced by their smile or laugh or giggle or crawl towards you or things like that.
and also the mothers.
Well, right, I mean,
Making
well,
the fathers and making them, like you said, giving them that reinforcement so that they feel, you know what I'm saying? Because sometimes the mothers can get a little bit.
right, it's important for mothers to know.
That the father is, sometimes if the father is not holding the baby exactly perfectly the way she wants, and it's okay, he's not going to break.
Right. So what I hear you saying is this, is there a way for women to, or mothers sometimes who might be a little overprotective, to back off and provide positive reinforcement for a particular behavior that's almost kind of like what they want? And that's a common part of behavioral modification, which is called using successive approximations. Successive approximations of the behavior that you're looking for, right? So whenever you, and this you can use in parenting or anything else, right? So when you're learning how to do something for the first time, or teaching someone how to do something for the first time, when they kind of almost get it, reward that. When they kind of almost get it better the next time, reward that. So reward each successive approximation of the particular behavior that you're trying to encourage. And that will be reinforcing for the individual to do better the next time. So what you're saying is true. Can you just tell the mother to back off a little bit so that the father can engage more in the way that he knows how to engage? Yes, absolutely. And then remember to reward the behaviors that you want and not inadvertently punish those behaviors that you want by saying, well, you're not doing this exactly right, it's driving me crazy. Just sort of learning how to accept when things are not done exactly right, but when they're done almost good enough, right? And that's a whole